So you're just like, okay, not only am I doing something really cool, I'm at the cutting edge of technology, we're doing things that nobody else has ever done before. We're launching products that never existed before yesterday, but then they're actually making an impact because so many products, that's hard to find, right?
That's
It's
awesome.
hard to find where that impact is. We get to see both sides of it. Really glad we have that Slack channel going all the time.
Yeah.
Creators participate because it really just keeps you going and it makes you think, okay, what we're doing does matter.
Yeah, it's awesome. And because it becomes instant fuel for everyone else internally to really care even more about the real people, real stories, real results that they're bringing. It's not just this, call it words on a screen, right? Hey, no, good, we did a good job here. It's like, no. This is the entire thing that happened with this specific person, and it happened because of you. Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Dale Ellicott, who is the VP of Growth at Rely Health. Dale, thank you so much for being here today, and welcome to the podcast.
Yeah, thanks for the invitation. Looking forward to it.
Yeah, I'm super excited to have this conversation. I'd love to start off, just as I do every single one of these talks, just you sharing a little bit more to the listener about you, about the company, who you guys are, what you do, who you help, and any other context you'd like to share.
Sure, that'd be great. Like we discussed earlier, very similar background to you. I started out as an athletic trainer in sports medicine, so hands-on clinical work in the rehab space for about 10 years. Ended that career with the Philadelphia Phillies, and then took that experience and all the device knowledge I had into the sales world. Had some great experiences there, working with stroke, brain injuries, and pretty intensive rehab processes. Worked in the inpatient rehab hospital when bundle payment programs started coming out. So that was an interesting time. And then have worked in the digital health space with different startups, selling solutions there for probably the last 6 years.
Amazing. And tell everyone a little bit more about Rely Health as well. Some context on the company, who you guys are helping, and what you guys are providing.
Sure. Rely Health is patient care navigation. We use a hybrid model of AI agent first to reach out and communicate with patients. The issue with care navigation has always been there's just not enough human capacity to do it. And we've only really had humans that could handle this. Now AI has advanced so much, we can have a very intelligent conversation with a patient through AI agents, gather the information we need to gather, help them schedule a follow-up appointment, let's say, check in with them the day before to make sure they're able to do that. We no longer need rooms full of $60,000 FTE employees. What we want to save those employees for, we're not taking anyone's jobs, but we want to take that low-level work off of their shoulders so that when they are engaged with the patient, they don't feel like they have to rush off the phone because they have 20 more calls to make.
Yeah, no, that's awesome. Thank you so much for sharing that. And I think now, especially as I don't like using this, but the digital age and AI age is coming through, like it's such a buzzword now. But in a way, it's also true. It's also true. And businesses have to adapt. And I think in healthcare, it's so important because there are so many good things that can be optimized so that, for example, the professionals can focus on the things that they started for in the first place, which is actually helping people as opposed to doing a lot of admin and making sure there's follows, all these a million different things. So I would love to hear from you. When you guys are working with your clients, what are some of the biggest pieces of feedback that they share with you guys on, hey, this is something that's been helpful so much, so helpful for us and so valuable in our day-to-day? What are some of those patterns that you notice that really brings value to everyone you guys are working with?
Yeah, the biggest thing is we're taking a lot of administrative work off of clinician shoulders. So, you have an RN, maybe master's RN, and they're spending time dialing the phone, trying to get a hold of patients to ask them how their experience was. That's not top of license work, right? They should be patient facing. They should be engaging with patients that maybe are having clinical challenges, that maybe had a reaction to their medication. So they're really excited, one, so that their staff gets to work at top of license, but two, that we're actually connecting patients to the care that they're recommending. So typically that's where it stops, especially a lot of our clients, our hospital clients. They have a case management team. Case management team will say, yes, you need to follow up with a cardiologist. Here's a couple cardiologists. They don't make the phone call for them. They don't schedule that appointment, and they don't check in with them to make sure if there's any challenges or not. A lot of times we'll call a patient the day before an appointment and they'll say, yeah, we're not going to follow up. We feel pretty good. And, I don't have a ride anyway. Had we not interjected there, that appointment would have missed that cardiology visit. That patient would probably end up back in the emergency room with a revisit that costs the hospital system a penalty. So those are the type of things that get health systems and get our clients excited is
Mhm.
it's the things we want to do. We just don't have the capacity to do.
Yeah, no, and it's all, thank you for sharing that as well, because one of the things that really jumped out at me from our first conversation, which of course nobody listening in was part of,
Yeah.
was exactly that you guys go far and beyond to make those connections. Because even just talking from personal experience, even though I'm actually not in the US, that same issue happens here. It's like, hey, great, you go to your general practitioner, have this conversation. Yes, go now talk to the specialist, and then it's like 3 weeks, and then now you have to start doing extra stuff at work, and your mind goes elsewhere, and then the kids, and then the dog, and like a million things get in the way. And even sometimes if they don't, exactly as you said, yeah, I'm just feeling a little bit better, but symptoms and signs not always give us the full picture, right? So it's
Exactly.
so awesome to be able to have that full cycle and that full connection to go to where they need to go, because at the end of the day, people's healths are at stake, and that's the most important thing that they need to care for. So thank you so much for sharing that as well. One of the things that was cool too for me is in that entire cycle, I believe, and I don't know the numbers on this or how what it actually looks like on the back end, but the majority of times getting to a specialist can often take like months, right?
Yeah.
Really, it gets to a point where you now go to the appointment. It's like, oh, I forgot about this. I didn't even know that this was going to be in my schedule anymore. Do you find that during that process, the patients really need to be more engaged and reminded that they will be going to that appointment and all those things, so that it's always top of mind, they're taking care of their health? Or did you guys find that just making sure that everything is set in place for them to show up suffices in terms of how they're feeling and actually getting them the help that they need?
Right. No, it's the continual touch points
Mm,
are crucial. And the idea that there's no way for human capacity to do that, right? You're not going to call them right after they leave the emergency room, make sure they're doing okay, make sure they picked up their script,
mhm,
remind them that
mm,
they have an appointment coming up.
mhm,
um, Calling them the day before. One of the biggest issues with most physician offices and one of the highest cost things that occur is a missed visit, right? A no show. So
mhm,
now you have time carved out in a physician's schedule and somebody doesn't show up.
mhm,
So those are the type of issues that we're solving, is just checking in with patients, making sure they can be there, making sure we're scheduling at times they're available. There's a lot of programs out there. You'll get a text the next day and it says, "Hey, you got an appointment at 3 o'clock." Great, that's when my shift starts, right?
yeah.
And then it's like, well, I have no one to call back, so I'll just let it sit. Now
Uh-huh,
you've got a
uh-huh,
no show. Now you got a patient not following up. Now you might have an ED
mhm.
revisit or readmission. So that's really just that snowball effect of poor communication.
And then another 6 months now because you missed that one, right? So it piles on. It doesn't seem like it does, but it does pile on, which is never any help to anyone.
Yeah.
I
And
would love to. So go ahead.
one of the other parts of our program is our navigators are actually building relationships with a lot of these specialists.
Mm,
So we'll work with a client, we'll meet all of their physician groups, their specialty physicians, their PCPs. And our average is, I think, 7.5 days till your PCP appointment. If you
okay.
didn't have a PCP, 8.2 days to a specialist. The
Mm,
average is about 30. So that's
wow.
another component that
Yeah.
if it's top of mind, if you have an appointment next week, you'll probably remember you have that appointment and not book over it. You have an
Hmm.
appointment 30 days out, the likelihood of remembering that pretty low,
Yeah.
right?
No chance. No chance. Even with all the technology that we have nowadays, like
Yeah,
people forget, things get in the way. So yeah, 100%. Really awesome. Thank you for sharing those numbers as well. One of the things that I think I've heard being a pattern a lot in these conversations is that with the implementation of AI into so many of the systems, processes, and things that companies are doing, sometimes prospects and possible clients can be hesitant on the adaptation of that,
yep,
because it may seem that the human touch is no longer there, and it's not the same connection as before, or maybe the investment of time that they're having with their current team for what they're doing and the usual way of doing things is
yep,
more than enough, when we all know that's definitely
yeah.
not the case. What do you say to that, in that loss of human touch and that humanity aspect of things?
Yeah, the key is really in the deployment and collaborating throughout that implementation process.
Hmm.
So, like, one of our biggest things, we take a lot of time with our clients figuring out, okay, what do you do today with most of your time? And really, the boots on the ground folks, the nurses that are making the calls, the navigators that are making the calls, what would you like to be doing with that time?
Mm,
The answer is always spending more time with patients,
mhm,
right? That's why they're in healthcare.
Yeah.
So then we look at, okay, what tasks are distracting you from that, and can we use AI to automate that? Or our approach is always a hybrid approach. We always have a human in the loop. Maybe AI can't handle that task, but maybe some motivational interviewing is needed. We can fractionalize some back office team members
Hmm.
to
Hmm.
have those conversations. You
Mm,
see it a lot in senior care. A lot of seniors are lonely and bored and just they want to have a conversation. Our seniors have probably 2 to 3 times as long of conversations with our AI agents as anyone else does, which is very surprising. Everybody's,
interesting.
oh, seniors won't use technology,
Yeah,
right?
literally. Yeah, I would not expect that.
Right. They just want to be able to have a conversation and talk to people about their healthcare and things like that.
Hmm.
Sometimes we hear about their cats, but luckily AI is smart enough to parse that out and not put that
Yeah.
in the medical note. So we're seeing it help in a lot of different areas. But
Uh-huh.
imagine that 15-minute conversation when you only have 15 minutes to meet with a patient
Yeah.
physician,
Yeah.
right? You don't want to ignore their conversation. You don't want to ignore their need, which is that interpersonal
Hmm.
relationship.
Hmm.
But at least now they have a little bit more of an outlet for that as well.
Yeah, no, that's really awesome. And I think we all know that there are always some people who do tend to start rambling on and forever. And then I just have the cat comes into the conversation and like, oh,
Yeah,
everything else that piles on is like, hey, let's focus on here. But as you said, there's only so much time in the day for a team to take care of that. So having a tool to implement is really, really awesome. I would love to shift the conversation here, Dale,
sure.
into the company itself, into Rely and what you guys are doing.
Yeah,
I always say this to my team internally. I think VPs of growth, VP of revenue are two leaders that I always love to talk about because yes, we want to reach the impact. Yes, we want to help more patients. Yes, we want to help more clients, et cetera, et cetera. But at the end of the day, the company has to grow for all of that to happen.
right.
So I would love to also hear from you when looking at that growth. Business is not always sunshines and rainbows. So, what are some of the challenges that can sometimes get in the way of achieving the growth that you guys are striving to achieve and the goals that you have for the organization?
Right. The biggest thing is just getting people to talk to, right?
Mm,
A couple previous companies I was with, they hired up a sales team thinking that the sales team would generate demand. In healthcare, that's not always true. There's not a
mm,
lot of healthcare providers sitting around waiting to answer the phone, right?
mm-hmm,
You have to either have relationships or be very tactful about how you approach them.
mm,
Sometimes it's hosting events, sometimes it's getting out to conferences, things like that.
mm-hmm,
But taking a very dynamic approach to capturing the little bit of extra attention that a healthcare executive might have is really key.
mm,
An easy place to make a cold call, right?
yeah,
Rarely getting answered. So
uh-huh,
you have to be very tactful about it.
mm-hmm,
Luckily for us, we have some really good relationships with some physician groups. Building those relationships, building trust, being trustworthy, and actually solving people's problems, right? You can't
mm-hmm,
just
mm-hmm.
develop tech and walk away and hope it works. You could do that once and then you're done.
Yeah.
So, yeah, really, really being a trusted partner is essential in healthcare.
Oh, interesting. And I just want to make sure I understand that correctly. Do you mean that in a frame where it's just really a matter of being able to come into the awareness of a lot of these physicians, these health professionals, and then engaging in that talk, and most importantly, having them engage back?
Right. Well,
Mm,
and knowing the vernacular, understanding healthcare, like, it's a huge mistake to bring someone with no healthcare experience, put them on the phone with a physician,
yeah.
right? So if that happens to be your sales team, if that's what the market was able to
Mm,
perform for you, you better have a medical director that's willing to hop on that call,
mm-hmm,
right? You
mm-hmm,
better engage some of these medical professionals to support your sales team.
mm.
Can't just expect to put a sales guy with no healthcare experience on a call with an MD and that turn out well. So
Yeah, probably not going to work out for anyone in any scenario there. And that's so
right,
interesting. Earlier in the conversation, Dale, you mentioned our similar backgrounds, and actually,
yeah,
for everyone that's listening in, Dale and I both worked with athletes. I did more so on the performance execution, the performance side and the physical side of things, whereas he did more on. So actually, remind me on the a little bit more on the area that you were doing again.
a little bit of both. So I was an athletic trainer, which is basically therapist for specifically for athletic teams.
Yes, yes.
Responsible for everything. I say it's kind of my first experience with population health.
Hmm.
I
Hmm.
get 1,200 athletes every year when I was at the university level. And you managed everything from they've got the sniffles all the way up to let's schedule a surgery and do the full
Mm,
rehab.
okay, got
So
it.
Yeah.
There's a lot. Okay, lots of things going on there. I definitely did way less than Dale did. Really, just working with the athletes and helping them there as well. But the reason why I wanted to touch back on that is because I'd love to hear from you, based on maybe some of the experience that you received there. But as you are now transitioning into your new endeavor into your career,
Yeah.
is there anything that you wish you knew before you started? Maybe any pieces of advice that you would have looked at yourself from now, looking back and say, "Hey, Dale, take care of this, do this way, don't make this mistake," that you think would have been very, very valuable for you?
Yeah, I think one of the biggest things early sales reps, every early sales rep makes the same mistake. They think they're there to talk. They think they're there to
Mm,
present. They're there to listen. If you spend 80% of the call listening, you'll have such a better understanding of the client, and the client will respect you a lot more,
mm-hmm,
right? Because that's what healthcare is a business of
mm-hmm,
solving problems. You're not going to sell a widget off the shelf out of the box without customization. Like some people do it, but it's, it'll end up in the closet.
yeah, yeah,
My first experience with sales was selling rehab devices, and one of my favorite clients was talking to her, and I'm like, "Oh, this is the best new thing." Blah blah blah. Early sales guy pitch, right? Here's the features, here's the benefits. So I was
yeah,
going,
yeah, yeah.
she's like, "Let me show you something." She walks me over to this closet. There had to be over $1 million worth of equipment in there.
Mm,
She's like, "All of this stuff was the latest and greatest, but it didn't solve any of our problems.
mm,
We bought it, we put it out there, it couldn't document, it didn't help, nobody explained it, it broke down." She's like, "I don't want to buy something from you and have it end up in that closet, right?
mm,
So how are you going to work with me to make sure that doesn't happen?"
mm-hmm. Wow.
That's not a widget sale, right? That's not features and benefits. That's customer service. That's solution selling.
Yeah,
That's making sure your product fits the problem they're trying to solve.
yeah. Really focus on the outcome. I think that's what so many companies is. I mean, even ones that I've spoken with here on the podcast as well are included. Nobody is perfect here. They just
Yeah,
really focus on how great they are and the amazing types of the things that they do in their service and their product and all these things. But then they forget about the outcome. They forget about the things that the patients truly care about. And you said something that actually reminded me of. Are you familiar with oh my God, what's his name now? There's Tony Robbins, and then there's his very good friend. I'll remember his name. I'll remember his name. But he says something that really reflected with what you said right now, which is, yes, understanding the clients that you're speaking with, but most importantly, making them feel understood.
right.
It's yes, I see where you're going through, but do they have that perception that you truly want to help them? You understand, and they have that feeling that confidence that you are on the same side of the table as them, and that you really truly care about their outcomes, which is so. Dean Graziosi, that's what his
Yeah,
name was. Dean
yeah. There you go.
Graziosi, is it, at least who I always heard that from. So it's really really interesting, and I appreciate that you're sharing that, because that, in my opinion, makes a huge shift in not only the way that you're quote unquote selling, but at the end of the day, bringing value and delivering really the help that you can for a lot of the clients coming through.
Okay.
Would you agree with that?
Yeah, to double click on your original question, I mean, that's what I learned from
Mm-hmm.
having that clinical experience being an athletic trainer.
Mm-hmm.
I would buy a lesser product as long as it served my needs if I liked the sales rep, if I thought they were going to be supportive, and if it was going to break, they were going to be there the next day. I had their
Mm-hmm.
cell phone number, right? I didn't want a sales rep that was going to come in, sell me something, disappear, and tell me to
Mm-hmm.
call a customer service line.
Yeah. Uh-huh.
I want to
With
know that
commission breath.
right, you're going to make me successful is
Mm,
what I'm buying. Uh,
amazing.
I'm not buying a product. So
Yeah. No, I love that. Thank you so much for sharing that. I always love to ask a question on this podcast too, Dale, to almost every single one of the guests that I have on. And I think you would also be a perfect fit for me to ask that question. And the question is this: let's say you had a magic wand and you could just wave this amazing, phenomenal wand to solve just one challenge, one obstacle, a hurdle, whatever you like to call it inside of the company. That would allow you to, of course, reach your impact goals, but most importantly, the growth goals, the revenue goals, the client acquisition goals, all those things. I think as business leaders, sometimes we have a million different things that we're trying to prioritize and focus on. For
yeah.
this magic wand, you just get one thing that would allow you to reach all those goals and grow the company in whatever way that you want. What's the
Right.
one
No,
thing
to
you want
take
to solve?
this from a early startup perspective, right? It's being able to balance out demand and delivery. It's always such a challenge for startups,
Mm-hmm.
right? So sales team's doing well. We signed a bunch of deals. Now, we got to hire up on the ops side, and we need these people, and we need those people. And hey, you're going to have some product hiccups, right? We
Mm-hmm.
need 3 more engineers now. So like, I've it's so rare in a startup to have the product functioning exactly how you want, have the delivery functioning exactly how you want, and have the commercial side exactly how you want, right? You always get one, maybe two at a time, but there's always one that's trying to catch up and trying to struggle. From my perspective, hopefully it's not sales, right?
Mm-hmm.
Nothing worse than being in a company that's starving for sales and starving
Sure.
for leads, because that's the scariest place you could be as a startup.
Mm-hmm.
Not being able to deliver on that, also big issue. It's a small industry. Healthcare is not that large, only 7,000 or so hospitals. You can't fail that many times before everybody hears about it. So
Mm-hmm.
I would say, the wand would give me balance. Every time I sold a deal, I had the exact capability to deliver what I sold.
Mm, awesome. I really like that. I don't think I've heard that before for that question. And so yeah, thank you so much for sharing that. I have one final question for you as well, Dale, which
Sure.
is actually not a question from me. It's a question from our last guest to you, and they had no idea who you were. So here's the question. You ready for it?
Yeah.
This is a bit of a deep one. Is there something in your professional life that makes you just as happy or brings you great joy in comparison to your personal life?
Yeah, I mean, we get a lot of great patient success stories all the time. So we have a channel on Slack where
Mm,
our navigators are out there interacting with patients. Just, you get lost with that, especially from the commercial side. It's how do I sign this contract? How do I get through the BAA process? How do I get through the security screening? And then you're relieved. But then all of a sudden, one of our navigators pops up a story, and it's this grandfather that the grandson's parents just passed away,
mm,
and he just got custody of the child. Didn't know who their physicians were. Didn't know anything about some pre-existing conditions. And our navigator was able to look back in that medical record, help guide him. This is the next appointment, things like that. I mean, the letter that grandfather wrote us was just amazing, right?
wow.
So you're just like, okay, not only am I doing something really cool, I'm at the cutting edge of technology. We're doing things that nobody else has ever done before. We're launching products that never existed before
Hmm.
yesterday. But then they're actually making an impact because so
Mm,
many products, that's hard to find, right?
that's
It's
awesome.
hard to find where that impact is. So
Hmm.
we get to see both sides of it. Really glad we have that Slack channel going all the time.
Yeah, yeah, yeah.
Getters participate because it really just keeps you going and it makes you think, okay, yeah, what we're doing does matter.
Yeah, it's awesome, and because it becomes instant fuel for everyone else internally to really care even more about the real people, real stories, real results that they're bringing. It's not just this, call it words on a screen, right? Hey, no, good, we did a good job here. It's like, no, 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 no. This is the entire thing that happened with this specific person, and it happened because of you. So
Yeah.
it's like, oh man, it really gets people fired up. I would assume as well.
Yeah, and that's how we usually try and end like a discovery presentation. If we do an RFP presentation, we always have those patient stories,
Amazing.
and they're long, and we read every word of them. And we're like, we showed you why you might want to choose our solution. We showed you how we're going to implement it. We showed you the effect we think we're going to have. But this is what's really important, right? This is
Mm,
why you guys got into healthcare. This is why we do what we do. And it's not a prop. It's not a gimmick.
hmm.
It's real. Like we can really make an impact with this partnership. So,
Amazing.
um, love hanging our hat there.
Amazing. Everyone, ladies and gentlemen, Dale Ellicott, thank you so much for your time. This has been so, so incredible. Where should people go if they want to learn a little bit more about you and, of course, also a little bit more about Rely?
Sure. Just website, www.relyhealth.care. So CARE at the end of that is to learn more about Rely. And then, yeah, for me, I'm on LinkedIn all the time. So just Dale Ellicott. I think I'm the only one on there. So you can find me pretty easy. Always happy to converse. Always happy to have conversations like this, and appreciate the invite.
Amazing. I will leave as many links as I can for Dale and Rely down below here if you want to check it out. And if you enjoyed listening to this conversation, you want to hear even more conversations like this, please hit the subscribe button and I will see you on the next episode. Dale, thanks again for your time.
Great. Thank you. Bye.